It's your village girl, Dr. Dakalo Ndouvhada, and this is the Doctor's Corner podcast. A corner where we have health insight, real conversation, and we have experts to come and share information with us. Today, we have a topic that needs to be highlighted, which is Pharmacy Month. And I have expert in that field, which is Rendani Tshilambwana. She's here to share information with us, and we all know that the topic for this year, or the theme for this year, is Think Health, Think Pharmacy. And Rendani, welcome to the podcast.
Thank you.
I'm so excited to have you.
Thank you for having me. I'm so excited to be here. I'm a little bit nervous.
Yeah, it is nerve-wracking.
Yeah, but I'm really excited to be here. Thank you so much for inviting me.
Yes, I'm also happy to have you here. I just want you to introduce yourself. What do you do? I know that you are a pharmacist. I've always known you as a pharmacist, but people will want to know, who are you and what do you do?
Yeah.
And how did you get here?
My name is Rendani Jenniffer Tshilambwana. I am a pharmacist. I hold a Bachelor of Pharmacy as well as a Master of Pharmacy in Public Health Pharmacy and Management. I also have a certification in Good Clinical Practice. And I think in my pharmacy career, that is essentially what I am and what I hold. But outside of that, I am an entrepreneur and also a content creator / influencer, although I prefer the content creator side. Yeah.
Okay. No, that's a lot. You are doing a lot.
Yeah.
It's a master's. Oh my God. Okay. So, when this topic came up, right, I was asking myself, what is Pharmacy Month? Why is it important? Why do we have to talk about it? And then another thing that struck my curiosity is think health, think pharmacy. Yes, I am a doctor. I know the pharmacy in the hospital. But what does it mean to celebrate Pharmacy Month? And why is it important?
Okay.
Yes.
So maybe just starting with the Pharmacy Month side of it. So Pharmacy Month is September every single year. And it's basically a time for us to celebrate pharmacists, pharmacy personnel, and also to educate the public about pharmacy-related information, also any related topics. So every year we have a different theme, and this year's theme is Think Health, Think Pharmacy. So what that theme basically entails is that when you think of healthcare or when you look for anything that has to do with health, you must think you can get it at a pharmacy. Because in most instances, you find that people only think of a pharmacy as just a shop where you go and buy whatever you need and then you leave, right? But not a place where you can actually get healthcare services. And when we say think health, think pharmacy, we are saying when you want a certain healthcare service, you can go to a pharmacy and you should be able to receive that service. If not, because of course there are certain things that cannot be done in a pharmacy. If you can't, then the pharmacy personnel, the pharmacist or pharmacist assistants should be able to direct you to the relevant department. So that's basically what Think Health, Think Pharmacy is about. And also to sort of educate the public on the fact that pharmacists are not one. It's not one sector.
Yes.
A lot of people only look at, one sector, or they know of one sector. So this is also to say, when you think of health, you mustn't just think of or when you think of pharmacists, you mustn't just think of pharmacists as someone who gives you the medication over the counter, but also health as a whole. We do play different roles in health that people, a lot of people, even colleagues within the health sector don't know about. So that's basically what it's about. I know that was a mouthful, but in a nutshell, yeah.
Yes. You said on your qualifications, you said you did Masters in Public Health, right? So that struck my, like when you say that there's like different roles that pharmacists play, right? As a doctor, I always have to refer my patients to a pharmacist.
Yes.
And the only pharmacy I know is the pharmacy at the teller, right? The one who's going to dispense medication to the patient, right? And now when you say you play different roles, it means that there's a lot that pharmacists do than just read a script and dispense medication to patients.
100%.
Yes, I think someone might be asking, what do you mean by that? The only pharmacists we know, it's those people that are selling medication to us, right? Can you expand on that? What are other spheres of pharmacy?
Yeah. So I like that you said, when you go to a the pharmacist that you think of is when you write a prescription and then it goes to a pharmacist and then they read it out. I'm a pharmacist and I don't do that. I don't remember the last time I received a prescription to check what's being prescribed. I need to dispense this. I need to dispense that. I, for example, am in the medical aid sphere, and I also work from home, which is another. You're a pharmacist. How are you working from home? Yes, because most of the things that we do are things that you can do from home. It's mostly medical aid administration, ensuring that when you go to the pharmacy and you want to claim for your medication from the medical aid, that claim goes through. Are there any issues with that claim? We also resolve that and we assist and see how best. And, coming up with the in the medical aid sphere, coming up with the different formularies for the members to ensure that when they go to the pharmacy, they can get this medication, which medication is covered, which one is not covered. All of that involves pharmacists. Everything that is, related to medication, pharmacists are involved. So that's just one sphere. But then there are so many other sectors. For example, you've got pharmacists in the industry.
Okay.
Industry on its own has multiple segments within it. So you've got the industrial pharmacist, and under that you get production pharmacists, you get quality assurance pharmacists, warehouse pharmacists, supply chain, pharmacovigilance, research pharmacists. Okay. So there are multiple pharmacy sectors within the bigger sectors. And then from there, you also get academia. So these are your academic pharmacists. These are your lecturers, people that you'll find in the academic space, your professors, people that are in research, working with different institutions to provide information to students, and also just the general public in the academic setting. So pharmacists in the hospital and retail sector are usually the last point of contact for the patient before they take the medication. So if they're coming from the doctor, then they go to the pharmacy, they get their medication from there, and then as the pharmacist in that space, you are the last contact to ensure that this medication that I'm giving is the right dose, it's the right medications for the right patient, all of that information, all of that stuff. So I think they're very vital. But at the same time, I think all the pharmacists within the health sector play different roles that work like a machine, and in order to ensure that the patient gets the medication. Because in order for you to have the medication in the pharmacy, a pharmacist somewhere had to produce that medication. Before that medication was produced, a pharmacist had to be part of some research in order to ensure that that medication is safe for use. So there is a whole process to it from the beginning to it being given to the patient.
Yeah.
Yes. So there are quite a number of pharmacists. And I think another one that we can also highlight, especially in the topic that think health, think pharmacy. We also have PCDT pharmacists.
What is that? That's a lot.
So yes, PCDT pharmacists are primary care drug therapy pharmacists. Okay. So what they do is not only do they dispense medication, but they can also prescribe. Oh, okay. So they can prescribe up to Schedule 4 for some medication and some conditions, usually primary health care. In fact, not usually, it is for primary health care. It is primary care drug therapy. So with PCDT pharmacists, a patient doesn't have to, for certain conditions, a patient can just go to the pharmacy, usually primary health care conditions. The PCDT pharmacists can prescribe up to Schedule 4 of some of their conditions, and they don't need to make multiple stops before getting healthcare services. So when they go to the pharmacy and there's a PCDT pharmacist, they can assist them, they can assess, they can diagnose, and then they can prescribe and dispense at the same time. And you do get those these PCDT pharmacists in multiple pharmacies now. But yeah, they need to have the qualification
for that.
Yes, it is a post-grad qualification. I think it's about 2 years that you do all the practicals and assessments and cases. I think it is quite loaded to ensure that they have the knowledge and they are
the knowledge
equipped.
To diagnose.
Yes,
and
exactly. To ensure that they are able to do what they say they're able to do. So it is quite, so that's one of the things. So if you do need health services, then you think pharmacy, because you can also get a PCDT pharmacist.
So from what you said, I learned from someone who in their head only knew that pharmacists are the ones that I refer the script to, and then they give the patient medication. Now I have more questions that for someone to go work in like the pharmaceutical companies for production and all those things, do they need to like further their studies into that, or like you can go from undergrad and then you just go and work there?
You can go straight from undergrad. There are there are internship opportunities available. So as soon as you complete your B.Pharm, you can work in any industry. I think it's always advisable to have something extra. I think for me, I'm one of those people that say, I feel that besides B.Pharm, what else do you have? What else can you do?
Upskill yourself.
Yes, you know, so I always say, if you want to do something more than just a B.Pharm, 100% go for it. Do it, even if it's not just to get into a certain space, but also to do it for yourself, to equip yourself with that knowledge. So there are people that get in without having to
specialize
their studies. Yeah, no, you don't need to specialize. However, there are certain spaces where if you have specialized and you have something extra, like if you have your GCP and you want to get into clinical research, then that's something they would consider. You know, if you want to get into the public health space, then you have a master's in public health, then they would consider that. And but it's not a must. It's just an advantage.
Oh,
It's not a, if you don't have it, you won't get in.
You won't get in.
No.
No. Okay. Yeah. That's very interesting. That is, I think every child that goes and says, I want to do pharmacy, they always think, okay, their only point of reference is the pharmacist that they see. And the fact that you shared all this information, it makes them think outside the box.
Yes.
Because we all have, I only have seen Rendani. I've only seen whoever. I've only seen the ones on the counter. So it means that I must do this just to be there, right?
And sorry, I just want to add, the ones that I'm mentioning here are the ones that I can think of right now. But there's
a lot.
Yes,
there's a lot.
There is a whole lot more. I myself still learn of the different places that pharmacists work in as I go. I'm like, oh, you're a pharmacist. There are people that deal with some of the marketing for the medication. The brand managers are pharmacists, you know, things like that. There are so many places where you can work. And if you are someone who is into marketing, for example, then you can also be in that sphere. Yeah. So there's a lot. Rendani is mentioning a few, but just bear in mind that there's a lot more. There's a lot more, yeah.
And are people allowed to come and ask you if they feel like, okay, I need more information
100%.
on this? Okay, so guys, Nyambona, ne? She said yes, come ask.
Yes, guys, so please come and ask me. I think, I don't know if you can put my handle or my details somewhere on the screen.
On the description box and also on the screen.
And also on the screen, for those who are listening on maybe Apple Podcasts. I'm just assuming. I'm not sure.
Yes, no. For those who are listening from Spotify, or wherever 100%. You get your podcast, it's your handles. We'll say them at the end. Just wait for the end so that you can get the information right, okay?
Yeah.
So, I feel like as a doctor, right, the fact that you have highlighted so many things, I think I feel so bad for not knowing that there's more to what other people are doing. I think it's the same thing with my career, that I feel like I don't actually... I'm that girl who grew up knowing, okay, there's only one way. There's only one way. And I'm sure one other village girl can relate to, okay, oh, I can actually do this via this, and I can go work in the industry and all this. Because not everyone is meant to be talking to patients and like interacting with patients. And some people just don't like doing that. They can 100%. Just work in the factory. They can just work doing research and all those things, right? So... contact Rendani and ask her. And if you're only watching us now, I'm still your host, Dr. Dakalo, and we're talking about all things pharmacy. Think health, think pharmacy, which is the topic, the theme for the year for Pharmacy Month, which is September, which is something that is celebrated every year, as she has highlighted, right? So I'm sitting here, I'm a doctor, and you are sitting there as a pharmacist.
Yeah.
I think where I work, the pharmacy is the happiest place. Whenever I feel like, okay, I'm telling you.
That's a first.
I'm telling you, like, every time I feel like, I want to laugh with people. I go to the pharmacy and I just sit there. And also the fact that I'm just started working in private. I don't know all this private medication, right?
Yes, yeah.
So I have to go there and like, ask, you can actually mix indapamide
with this.
And I'm like, okay, how does that work? Okay, because where I'm coming from is like, you give Redac, you give Amlock, one. There's no
separate
combination and all those things. And so I'm learning. So that's why I made a relationship with pharmacists, because I feel like, okay, I need to learn from the experts, right? So, but that's not the case.
Please say that
everyone.
Again.
So,
please say that
I
again.
go to the pharmacy to learn from the experts, right? Because I know that's not my field of expertise, but there's the right people for it. And I think with that being said, when I make a diagnosis, the pharmacist gives the medication. Sometimes you can make like you can write a script wrong, right? And there you need to give the patient, right? So there needs to be, for a patient, good patient outcome is that I have made the right diagnosis, written the right script. You confirm that the script is correct.
Yes.
So the doctor-pharmacist relationship is something that is very important for patient outcome.
Yeah.
But we know it hasn't always been the case.
Yeah, that's a very nice way to put it.
From a pharmacist. Yes.
That's a very nice way to put it.
So I want to know, from a pharmacist's point of view, how can we work together to have a best outcome for our patients?
To be honest, what you said, right? I love the way you started stating that you do this part and you know up to here, and because you're not the medicine expert in this regard, you're gonna befriend the pharmacy.
Yes.
That is not the case from your colleagues, right? Not all, I'm not, obviously not all of them, but I'm just talking when we look at the relationship between doctors and pharmacists
in general.
It's a love-hate relationship. It's a push and pull every now and then. You know how it is in most instances. But I think just knowing that, like you said, I'm going to get medicine advice from the medicine expert. And then from our side, as well as pharmacists, we also know that this person, I'm not the one, for example, say I'm working in a retail pharmacy for today, let's say.
You're a retail pharmacist.
I mean, I've got the knowledge. I have worked in a retail pharmacy, but I'm not currently working there right now. But let's say I'm in a retail pharmacy or I'm in a hospital pharmacy and you've referred a patient from your ward or whatever the case may be. I need to understand that I did not diagnose the patient. I did not examine the patient. So I don't know what you saw.
Yes.
So when I see the script and I see there's something wrong, I also need to find out from you what is the thought process behind prescribing 1, 2, 3 for this patient. So I think sometimes egos get in between.
Yes.
There's a lot of, no, but I know better. And then, the pharmacist will say, no, but I know better. And the doctor will say, no, but this is my patient. I diagnosed this patient, so you need to give whatever.
No one owns the patient, guys.
No one leaves their house with a patient.
This thing of my patient, it's so dangerous because now
extremely
you are unable to involve other people because it's
then it defeats the whole purpose of having a multidisciplinary team. And which is the whole point of having pharmacists, doctor, physiotherapist, occupational therapist, all these different healthcare workers. We are all here so that we can work together
for the better outcome of the patient.
It's not for
me. Yes,
exactly. So you see how you and I right now are on the same page in terms. I think that's where it needs to start. It needs to start from pharmacists and doctors understanding that put your ego aside. I won't lie. There's ego on both ends.
Yes.
Also, I think it's also because of how maybe we're trained, because we are trained that, if you see a script and there's something that you're not comfortable with, you need to be vocal and confident and stand by it, especially if you know that you've got don't be intimidated by anyone, so if you know that this is wrong, then I'll call you and say, Dr. Ndouvhada, 1, 2, 3, I think you need to do it like 1, 2, 3, or find out maybe why did you do it like this, and then but now in that call sometimes it doesn't end well, because now Dr. Ndouvhada will think, why is Rendani
questioning me. This is my patient.
This is my patient. I'm the doctor here. You need to do whatever I say. And unfortunately, that's not how it works. If the patient is in the pharmacy, then that whatever happens in the pharmacy needs to be decided by the people in the pharmacy. So someone who's not in the pharmacy, like the doctor who has prescribed incorrectly, for example, cannot dictate what the pharmacy must do. Yes. So the pharmacist has all the right to say, look, I'm not comfortable dispensing this. We have that the right to say no. Actually, I'm not going to dispense this because I'm not comfortable. And not because you want to punish anyone, but because if anything goes wrong, it comes to you. The lawsuit is going to come to you because you saw this prescription and you saw this and that, but you still gave it. Pharmacists are losing their licenses. Pharmacists are getting fined. They're getting hearings here and there. They're getting sued because of not reading and understanding prescriptions. Sometimes overlooking the small things.
The small details.
Overlooking it because it's not going to matter. It does matter. And it can get you in a lot of trouble. So that's why you always need to just confirm. Take that phone call, and even if it's just the smallest things, because sometimes I think that's another problem. Doctors will say, you're calling me for the smallest thing. Yeah, it's the small thing.
Yes. It's like, let's say I write a drug that has penicillin, right? And when you get there, you ask the patient, maybe I didn't even see that, and then I just wrote a drug that has penicillin, and you have to confirm and say, doctor, do you know that this patient, is an asthmatic? Allergy. You need to give an NSAID. Do you know that this patient is an asthmatic? You can't give this. Can we get an alternative? That helps the patient. Like at the end of the day, this patient who's coming out of here should get the best that they can for their condition. Exactly. Right? You know how I learned that pharmacists are very important. So I had to write a Schedule 6 drug, right?
Okay.
And it was a repeat script from a patient that has been following up with psychiatry. Yeah. Called the psychiatrist. I said, okay, are you aware of this patient? Yes, sir. Yes. Okay, sharp. I can write a repeat script. I wrote it, gave it to the patient.
And wrote times 6.
And I didn't write times 6. I said I wrote it for a month because they need to go to the psychiatrist to review, but they didn't have medication at that point, right? I didn't write in words. I just wrote in numbers like a normal script. Yeah. Right? And another thing is that I didn't think that what schedule is this medication? Yeah, I just thought, you are, for example, you are on Ritalin. Okay, Ritalin. Patient is confirmed to be an ADHD patient. Sharp. Okay, you go with the pharmacy called and said, Dr. Ndouvhada, we don't do it this way. This is how you write a Schedule 6. Yeah. I said, I'm listening. She said, no, you write whatever you're writing. You write in numbers. You write in words, right? And you write the patient's diagnosis, right? I was like, I didn't even look what schedule is this medication. Yeah. So then another level of me learning is that if you the medical aids needs you to be a dispensing if they say they need you to be a dispensing doctor. Yeah. I just thought being a doctor, I can just dispense. Yeah, and it's not the case. I need to be certified.
Yes, you need to. It's a course, for you guys. Yeah,
it's a course that you go and it's so difficult. You need to, like composing medication. Okay, you need to learn, when you write a script, you need to confirm labeling and what. I just like, I respect the people who do this thing. Yeah. This is definitely not my thing. Yeah. Because this is very difficult. Yeah. After learning all those things on that short course that I did, right, I realized that at school, we only do like a subject for however long, maybe a month, 4 weeks, and that's it, and we write an exam. But that's not our main focus, right? So there's the right people who the degree for however long, they know more than I do. So for me to be empowered, I must go to the right people. That's why I spend so much time in the pharmacy, so that I can get as much information as I can and be empowered. Because I think one of the superpowers that you can have is knowing your limitations. Yes, 100%. And knowing that there's people that are meant for that, and I must go to those people for it. Yes,
and sorry, but that's even from our side, we are able to say, this is something that will definitely need a doctor's intervention. Yes, you can go to the pharmacy and you can receive this there's these different healthcare services, but there is a certain limitation, and we also know that there are those limitations, and in those cases we are able to say, you know what, go to someone who's going to be able to do the proper assessment, because we don't do that in depth like yourselves when you do pharmacology. It's just a module, or it's something that you just do in passing, right? But it's not something that you dwell too much into. The diagnosis, all those tests that need to be done, we don't do all of that. What we do is towards the end, when now you have to treat this patient. So we understand that before we treat, we need to know what the problem is, what the main problem is, what the cause is. And in order to know that fully, you need to refer, and that's when you'll say, you know what, go to the doctor.
Yes.
But another thing you mentioned was with Schedule 6. When you said repeat, I thought you wrote times 6 because I was gonna be
no.
And I just wanted to put it out there that you cannot put times. But those are things that we see.
You see, those are the things that we don't know.
Yes, you find someone putting a prescription, writing a prescription for a Schedule 6. They don't put the words. Maybe it's just numbers, because it has to be words. It has to be numbers. For every number, there has to be a word, right? If you're saying 20, just for context, so for anyone who just wants more information, if you say 20, you write 20, you must still write TWENTY in brackets to say 20 as in this, right? And then you cannot say times 6 or times 3. You cannot repeat a Schedule 6 script. Yes, there are people that are on that medication every month. They have to be assessed every month, because if they're on that type of medication and they need it every single month, then they have to be assessed. And they should be assessed every month.
There's reasons, there's schedules.
Exactly.
There's it's not just I'm giving you, you're going to be fine. These are drugs that alter your body.
Yes.
Right?
Yes.
So just writing and then you buy, it's not gonna work. It's not gonna work at all.
No.
You know, one of the things that happened earlier this year, right? It's a thing that was all over the news, that in South Africa they found ARVs in water.
Oh yeah, traces of.
Yes, yeah. I read the article and I was like, why are the ARVs in water? Are you drinking them?
Yeah, that's problem number one.
Yeah, like I'm like, and also we know that water gets filtered. Okay, at least I know. Maybe someone might not know that the water you use, you wash dishes, gets back to you. You even get to drink that water, right? But my question, how did we end there? How did we get to that point of finding ARVs in water?
I think maybe, let's not say we found ARVs in water, but rather traces of some ARV medication in water. So traces meaning that some chemicals that form part of an ARV were found in water. Yes. And so one of the reasons for that is people flushing their medication. First and foremost, why are you not taking your ARVs? Why are they ending up in the toilet? Before we even get to the flushing of the medication, right? You need to be taking your medication. If you experience any side effects, and I mean ARVs are known to have some serious side effects, but those are things you need to discuss with your doctor and the pharmacist also, exactly. Yeah. And when you discuss it, you need to take that packet back to the pharmacy or to your doctor and not flush it. So that's how it happened. And it wasn't something that is, I wouldn't say it was, so even the article did state that, it wasn't something that was detrimental or affecting people's health. It was also mainly to affecting the aquatic life. Because if it's found in water, then it means that the animals in the water are also, you understand. And also, thinking about it, we also need aquatic life. Yes. We eat some of the food. Yes, exactly. So those are so you flush the medication today, and then tomorrow, I mean, obviously the timelines are not 100%, but like tomorrow you find that this ARV or traces of it are found in water that has aquatic life. That aquatic life is obviously drinking that water, and then that thing is killed in order for us to eat it, and then now we are, you know what I mean? It is a whole cycle. So we just have to ensure that when it comes to medication, it's disposed properly. I also blame media to some extent, like TV. We always see them flashing. How many times have you seen people just
like those scenes were like yes, and I'm like, people learn from that,
exactly,
and people want to leave out those things,
exactly. And I think that's where we need to start. We need to start there by no, don't flush it. That Coke, no, don't flush it. Take it to where it's supposed to. Like take that medication back to the pharmacy. There are take back programs in different pharmacies. If you have medication that is expired, you can take it back. Don't take and throw it in your bin. There's a specific way in which medication needs to be disposed. You don't just throw it away. I always say it's not just like a pack of sweets that you just, I don't like this anymore. There are chemicals that can be very deadly. So you have to make sure that when you take, if it's for example, acute medication, if it's for chronic, you have to take it. That's a non-negotiable for me. If you're on chronic medication, like you're taking your HIV medication, you have to take it. There's no need for it to even end up in the toilet. But if you are taking acute medication, where if you start feeling better, you can stop taking it, then you need to, if it expires, you need to take it back to the pharmacy, or to, I don't know if doctors take back expired medication. No, pharmacies do, but maybe this is also the platform for you to advise if doctors do take back
medication.
Yeah.
So I don't think that's a language that doctors usually speak.
Okay.
Right? On Sunday, I was very moved by the church, right? They announced that, okay, it's pharmacy month, all the old grannies and everyone. Yes, they did. I was like, oh,
love
it. It shows that there's people who are in that sphere, who are pharmacists, who are saying, okay, this is the information, this is what's supposed to be done.
This, yeah.
They said all the people that have medication that's expired, it doesn't matter what it is, just bring all of them at church. They will take them to the pharmacy and to be disposed correctly. Right? And that challenged me a lot, that this is something I should be telling my patients, right? I should be telling you that, okay, if you have that medication, like you find parents have amoxicillin, they give it to that child and then they give it to that child, right? It's my responsibility to tell them that, oh, if this expires, you need to bring it back. Like eye drops, you can't open them for more than 30 days, right? Yes. You need to dispose them somewhere, right? So that is something that we don't
put them in the fridge, things like that.
Yes, those are things that we might tell people, but I don't think we tell them in a language that they understand. Right? And maybe they're also not willing to accept that information. You also mentioned that patients actually, they get medication, like when you're talking about the ARVs and you have side effects and then they don't come. I always say to my patient, when you come to see a doctor, bring everything that you're taking so that I know, okay, you're taking this and this and this and that. Exactly. Do you need to still take that?
Yes.
Right? So, because other things you might be taking from Dr. 1 and Dr. 2, right? And they don't make sense. You can't keep taking polypharmacy, right?
Yeah.
So, with that being said, if you are having a side effect of ARVs or whatever you are taking, antihypertensives, you bring it back and you show the doctor, okay, this is what I'm taking. Or you go to the pharmacy and say, this is what I'm taking. When I take this, I feel this. I get one of the questions that a lot of patients ask is that there's ARVs in like a blue, the blue container, and there's the white container.
Yeah.
I know all of them, they're TLDs.
Yes.
But one patient would say, oh, when I take the blue ones, I feel fine.
Sick. Yeah.
The other ones will say, okay, when I take the white ones, I feel sick. So what is that? Because it's the same drug.
Yeah.
But just made in different companies,
yes,
right?
Exactly.
Explain what happens there. What is the difference?
So, to be honest, some of it is psychological.
Yes, yeah, mostly.
Especially when it comes to generics, right? There are certain people that feel that if it's okay, maybe for those who don't know what a generic is, it's when the active ingredient is exactly the same in pharmaceutical company, Dakalo and Rendani's company. We are both giving this medication. I I don't say brand names.
Oh, okay.
But yeah, let's say you're giving a specific medication.
Yes.
Right? A drug, specific drug. Because Panado, also another thing, Panado is not a...
It's not the active.
It's not the active.
It's just the company.
That's the company name. Which is why we try to avoid saying trade names because of that. So if this is the active ingredient, right? Dr. Dakalo or Dakalo's pharmaceutical company makes this like this, and then I make it blue and you make it white. The active ingredient is still ABC that we are both
we're giving
using.
the same medication.
We're giving exactly the same medication, but we are making it slightly differently. That's why you end up having a pink tablet and a blue one or a white one and a whatever one. So the side effects sometimes come from the fact that I'm used to taking a pink tablet. Why is it white now? Yeah. Why is it white? It's
giving me a headache.
It's giving me... But sometimes I think maybe I can acknowledge that some patients or some of the excipients, some patients may be reacting to some of the excipients.
Yes.
It's very uncommon. Very highly unlikely, but I mean, it is a possibility because the excipients are usually not the same. So the excipients are what is added to make that pill or that medication, but the active ingredient is what treats you. Which is the same from both sides. So the delivery part of it, which is the excipients, may differ from company to company, but at the end of the day, you're getting the same medication, which is supposed to give you the exact same effect as the other one.
Yeah. So I hope you had that. When I give you a white one and a pink one and it's the same medication, it's the same medication.
It's the same.
Okay?
If you've got side effects, I mean, it's okay to go back and speak to you. I always, I always say it's best to speak. I love patients that talk. I prefer patients that
ask,
that speak and say this and this, rather than keeping quiet and flashing that medication and then not getting treated, you see. So if you've got any concerns, again, if you need any healthcare services, think health.
Think pharmacy, yeah.
So yeah, you can always go to the pharmacy and you should also get that assistance.
You should ask.
Always.
Ask the right people. Because we
There's
always
no
give each other advice that is not from the experts, So I know this is very important because it's something that a regular person doesn't know and we don't usually talk about it every day. And a message to like my fellow doctors, let's educate patients on how to use the medication. What is the medication for? What not to do? That medication one is not for the whole family. Medication one is for you, right? It's not for the other person because we're not sick the same way.
Yes.
And our bodies sometimes are not made the same.
Exactly.
So I just want you to reiterate when it comes to disposing, like just give them tips or don't flush. Don't do this. This is the chain you need to follow to go and take him. Because now we've been having a conversation. Someone will still be asking themselves, okay, she said don't flash. But
what must I do?
What is the steps?
Yeah.
Where do I go? Who do I contact?
Okay, so first and foremost, don't flash the medication. Take your medication. Please be compliant. Complete your antibiotic course. If you're on chronic medication, drink your chronic medication every single day the way your doctor or pharmacist said you should take them. And then if you experience side effects, then go to the pharmacy and find out why you're experiencing those side effects and how you can get assisted. Don't flush the medication. If it's expired, it's something that you did not finish, maybe it was for something that is acute and there was no need to complete the course, then do take that medication back to the pharmacy. The pharmacists know how to dispose medication, whether it's schedule what or it really doesn't matter. Just take it back to the pharmacy. We know that even with, for example, in the pharmacy space, certain medication cannot be disposed the same way. There are certain schedules that are disposed a certain way, and then other schedules, some schedules like Schedule 6, you need a certificate, yes, like you need permission in a way to dispose of it, which shows you that this is not just something you can just throw away. So for someone who's watching and they don't know what to do with that cupboard there that's sitting with medication from 2002, please don't flush it. Please bring it
back
to the pharmacy. Please take it to the pharmacy. Your pharmacist should be able to assist.
Yes.
Yeah.
And the TV people, please ask the right people.
Please.
Ask the pharmacist, is this correct? Ask the doctor, should we do this way? You know, because the people are consuming that information. They take it home, you know.
Yeah.
They're like, oh, okay, I can throw this
flash,
there, you know, which is not right. And it's quite dangerous,
Very
right?
dangerous.
To the population.
Very dangerous.
And also, I think one other thing, since we're still on pharmacy, the cost that's written, if we say 5 days, this medication is 5 days. It's not how long it takes for you to feel better.
Yes.
You might feel better in a
day or two, yes.
But it's how long the medication takes to work fully.
Mm-hmm.
So
complete the course.
That's very important.
Very,
finish
very,
it.
Very important.
Finish it, because that's important.
Yeah, and yes, it's not for all meds, but you see, when you see that sticker that says complete the course, please do complete the course. And I think people do know which medication, like your antibiotics,
you have to finish.
Yes, you have to complete the course. So complete the course. Yeah, and if you're on chronic, take your medication daily. Set a reminder. Put it next to your toothpaste so that you don't forget to brush your teeth, do you?
Every day you brush your teeth.
So if it's right there next to your toothpaste or your toothbrush, you'll remember, oh, I need to take this. If you need to set a reminder, but don't let it get to a point where you now have to flush
the medication. Yes.
Yeah.
Next thing, we are dying as a community, you know.
But that article, I think it did raise a lot of it did make people scared, but I just want to assure people that it was not there's no research or any proof that it harmed people.
Okay.
Yeah. To just put it out there. It was not harming people, but it could get to that if we continue doing like flushing and stuff like that. Yeah. But for now, we are still fine. But don't flush.
I think we just went into highlights of different topics.
Yeah.
And there's think pharmacy. It's a big topic, right?
It is.
There's a lot that we didn't mention, right? And people might want to ask more questions. They can ask you. They can ask on the comment section, and then we can dive deep into it. You can interact with them. They can come on your platforms, right?
Yes.
And thank you for coming.
Thank you for having me.
I think that the people that I have conversations with, like the pharmacists that I have conversations with, they're always nice people, right? Yes, they're always nice people. Yes. And like I think we're also intimidated by how much you guys know and how much we don't. Yes, people that feel threatened is because they
that's
know
why they're always ready to fight.
Yes, because if you're not, you know, okay, this is not my thing. You ask, okay, you know,
I hear you.
So thank you, my fellow village girl.
Yes,
thank you for coming. Yes.
Thank you so much for having me. And yeah, I think just in closing, I think it's important for everyone to just remember that, you know, pharmacy is broad. There are a lot of things that I may have touched on today, but there's also a lot that we couldn't touch on, and very open to having the conversation 100%.
Yes.
And I'd also encourage some of the other pharmacists that are in spheres that I did not mention today, not because I don't know, but maybe because time and there isn't, I couldn't get to it. Please go to the comment section. Tell people what you do, where you are. I always learn a lot from you know, your LinkedIn's and stuff like that, where someone would ask that question, and then when you go and you're like, oh,
you're actually doing this.
So my degree can put me there, you know. And then just and just always remember that the pharmacy is not just a place where you just go and shop only.
Yes.
You know, you can do that and get all your makeup so you can look nice.
Yes.
It is health and beauty in most instances, but also just think of a pharmacy as a healthcare facility where you can get healthcare services, and think of pharmacists as professional healthcare workers that can help you. If they can't help you in that facility, then they will definitely give you the right information and referral and take you to the right place. So yeah, think health, think pharmacy.
So think health, think pharmacy.
Yes.
And for other pharmacists, like you said, if you feel like there's something we need to talk about, so feel free to comment and share your stories and how you got there. So someone might bump into your comment and it will change their lives.
100%.
You never know. Like, you never know how you could change someone's life. Just comment, share your story, correct us where we need corrections, add where we need adding. we're all welcomed here.
Yeah.
And thank you, Rendani, for joining me today.
Thank you, doctor. Can this be the relationship between pharmacists everywhere?
As it should. As it should.
You know? Do you know how much we could do for patients if we just got along, guys? Can doctors and pharmacists just get along? Not for yourself, not for your ego,
for the patient.
For the patient, for the outcome of the patient. It's not about you. It's about the patient. It's not your patient. No one.
It's our patient.
Yes,
we're all managing this patient.
Yes, all of us are important. You guys are very important, and your input is always valuable, and it's always nice interacting with doctors that are always, happy to receive and also give information. So yeah, thank you so much for this platform. Thank you for having me. And I hope this is like one conversation of many more that pharmacists and doctors can have in the future.
Yeah, no, it has definitely opened a conversation that people are going to have in rooms and everywhere. Everywhere where healthcare professionals are. It's something that will be looked at.
100%.
I would expect that it will be.
Yeah.
Right. Thank you, Rendani. Unfortunately, we have to come to an end.
Hate it.
And I hope other doctors and pharmacists can learn from us.
Please. And thank you.
So I just want you to tell the people where can they get you, and if you have the last words to say. I hope this is not the last word. Sometimes we'll invite you back. Well, on popular demand, but maybe someone would want to ask you a question. They might want to ask you directly and not in the comment section, because sometimes things are personal and not everyone is confident to just type
there.
Yes. Where can they get you? Where can they contact you? Can they even contact you?
Yes, they can contact me. 100%.
Yes. And what do you have for us? Is there anything else that we missed out that you want us to just talk about?
Okay. So they can contact me at Jenniffer_Rendi on Instagram. It's JENNIFER_RENDIE. And if you want to send something more formal, then you can send me an email, jennifer@ndaniholdings.co.za. So that's JENNIFER@NDANI holdings.co.za. That's where you can contact me. So just send me a DM or send me an email. I'm always happy to engage.
Yeah, no, that's. Thank you. I don't know. Thank you, Nganamara. Thank you so much. And as we're coming to an end, thank you for joining us on today's episode. This is still the Doctor's Corner podcast. Stay curious, stay healthy, and think health, think pharmacy. I'm your favorite village girl, Dr. Dakalo.